Hello, everyone. Happy Tuesday. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Tuesday, August 17th. I'm here to give you the update of the COVID-19 pandemic on Mobile County. So, reporting a cumulative number of cases 57,709. 356 cases were added yesterday. That is down quite a bit from what we were reporting or what we were seeing last week this time. So 356 cases reported yesterday, 280 reported on Sunday. We usually see sort of a slow start to the week, and then the number of cases increases throughout the rest of the week. So we'll see what that looks like. But it does appear that we may be seeing a slight a slowing of the record number of cases that we are seeing. Still extremely high case counts, some of the highest that we've seen since the pandemic began, but maybe we are starting to see a little bit of a slowing down of transmission in the community. We'll know more about that in the next 14 days or so, because again, we're still sort of holding our breath at what things may look like now that school is back in session and after school activities are in full swing and that sort of thing. So again, over 57,700 cases, 929 have died with COVID, 14 deaths were reported yesterday. We are now seeing a surge in the number of COVID deaths. Remember that first we see the spike in cases, then we start to see spikes in hospitalizations, and then 10 to 14 days later we start seeing spikes in deaths. So we are definitely seeing a dramatic increase in the number of people who have died with COVID. And the number of hospitalized yesterday broke another record, 480 people hospitalized in Mobile County. 30 new admissions were recorded yesterday. So the cumulative number of people hospitalized is 7,119, with 30 admitted yesterday and a total of 480 in the hospital with a COVID-19 diagnosis. Dr. Eichel got a call from a local funeral home yesterday concerned that they had 17 decedents on site that they were working on, with 5 more on the way. So at one funeral home yesterday, again, just a really concerned funeral home director calling about the high number of deaths that he was seeing at his funeral home. Let's see, I wanted to give a little bit of the information about vaccine coverage. So we have an internal report that helps us understand the uptake of vaccine by people in Mobile County, and these are Mobile County residents, so they might have gotten their vaccine elsewhere, but they're all entered into the statewide immunization registry. So the percent of Mobile County residents who've had at least one dose is at 42%. That is a slight increase, but the number who are fully vaccinated still sits at just around 32%. So we are not moving the needle very much or very quickly on the percent of our population that is vaccinated. So because we know that it takes some time to get the protection that you get from when you're fully vaccinated, we need everyone wearing masks and socially distancing right now to try to slow the outbreak. I had been seeing, I think when we started reporting these really high numbers, we saw 3 weeks of increasing number of vaccines given in Mobile County, but that dropped off last week. So it looks like maybe we were able to convince some people to get off the fence and go get vaccinated who maybe were just concerned when things got really bad. But I saw that drop off a little bit last week. So we will continue to push hard to try to get people vaccinated to prevent hospitalizations and deaths in people who get COVID even though they've been vaccinated. Lots to talk about with regard to vaccine, third dose, and monoclonal antibody treatment. First, let me say, just to remind everyone, that vaccination is your best defense against COVID. A few of you will get COVID even though you're fully vaccinated. But even if you do get it, vaccination will stop you from getting so ill that you require hospitalization or potentially die. Um, when we look at our case counts, the very high number of cases that are reported every day, over 90% of those cases are in unvaccinated individuals. And when we look at our hospitalizations on any given day, 85 to 90% of the people in the hospital are unvaccinated. And greater than 96% of people who are dying with COVID are unvaccinated. So, again, you can prevent getting COVID, prevent hospitalization, and prevent deaths by getting vaccinated, and then adding on that extra layer of wearing a face mask when you're around people you don't know, and distancing when you're outside of your house to try to slow the spread of this very contagious Delta variant. So I mentioned yesterday that the Centers for FDA and Centers for Disease Control have recommended a third dose for people who are immunocompromised. So this isn't really a booster dose. This is a change in the recommendations for the primary series for people who are moderately or severely immunocompromised. Again, moderately to severely compromised immune systems, people who have compromised immune systems should receive an additional dose, so a third dose, at least 4 weeks after your initial 2-dose series. So for immunocompromised people, we're really looking at this as a 3-dose series. You get your first dose, you wait 3 or 4 weeks depending on whether you got Moderna or Pfizer, and you get a second dose, then you wait a month, 28 days to get a third dose, and that completes the series, the primary series for people who have conditions like active treatment for a solid tumor and hematologic malignancies, blood disorders, receipt of solid organ transplants or taking immunosuppressive therapy, receipt of CAR T-cell or stem cell transplants within 2 years of transplantation, or taking immunosuppressive therapy, moderately or severe primary immunodeficiency such as DeJoy syndrome, Wiskott-Aldrich syndrome, or advanced or untreated HIV infection. There's one more bullet. Active treatment with high-dose corticosteroids, alkylating agents, anti-metabolites, transplant-related immunosuppressive drugs, cancer chemotherapy agents classified as severely immunosuppressive, tumor necrosis blockers, and other biological agents that are immunosuppressive or immunomodulatory. So if those are big words for you, some of them are big words for me. Check with your healthcare provider if you are unsure if you fall into that category of moderate to severely immunocompromised. Now, we don't need a doctor's note to vaccinate you. The state of Alabama is implementing an attestation process so that you can just sign saying, yes, I am in one of these categories. I'm not sure what the Mobile County Health Department is going to do. We usually follow suit with ADPH, but I just saw that form today, so it's too early for us to have put it into practice, but we'll let you know. So it's really important that if you are moderately to severely immunocompromised, that you get a third dose to complete your primary series. The other thing that came out this week as a Health Alert Network is basically talking about COVID treatment with monoclonal antibodies. And again, this is on July 30th, so just a couple of weeks ago, FDA updated their EUA for monoclonal antibody treatments to add the indication for post-exposure prophylaxis. So basically, adults or pediatric patients, 12 and older, who are at risk for progression to severe COVID-19 disease should be tested as outpatients using monoclonal antibody to reduce the risk of hospitalization or death. So again, because we have this surge in cases, this surge in hospitals, 480 people in the hospital yesterday, to try to keep people out of the hospital, strongly recommend that providers consider treatment within 10 days of symptom onset, within 10 days of known exposure, or within 10 days of your first positive test for anybody who's asymptomatic if they are in those categories that would put them at high risk for severe progression to severe disease. So again, the risk factors for progression to severe disease are high body mass index, chronic kidney disease, diabetes, immunosuppressive disease or immunosuppressive treatment, people who are 65 or older, or 55 and older and have cardiovascular disease, hypertension, COPD, or other respiratory diseases. And for 12 to 17-year-olds that also have BME greater than 85th percentile, so a growth chart for kids that would indicate that they may be overweight, or 12 to 17-year-olds that have sickle cell disease or neurodevelopment disorders, for example, cerebral palsy, medical-related technological dependence, for example, tracheostomy, gastrostomy, positive pressure ventilation, or have asthma or reactive airway or other chronic respiratory disease that requires daily medication for control. So if you are an adult or have any or a child that has any combination of these, that is a situation where we would like for providers to be aggressive about ordering outpatient monoclonal antibody treatment to prevent progression to severe disease, to try to reduce the number of hospitalizations that we have in our community. So monoclonal antibodies are not authorized for patients who are hospitalized, who require oxygen therapy due to COVID-19, or who require an increased baseline oxygen flow rate due to COVID-19, and those on chronic oxygen therapy due to underlying non-COVID related comorbidities. So again, this is for outpatient prevention of progression to severe disease in people who are symptomatic with COVID, have tested positive, but they're asymptomatic, or have been exposed to someone who had COVID, if you meet these categories of having a condition that would put you at risk of progressive severe COVID-19 illness that might require hospitalization. So if you have any questions about that, make sure to ask us on Facebook or send us an email, covid19@mchd.org, and we will get that information to you. But again, vaccine is really important right now, but because it takes some time for you to get protection from vaccine, we also need you to be distancing and wearing your mask. If you own a business or if you have any position of influence, lead a congregation, sign paychecks, run a daycare, if you have any position of influence, please consider layering back prevention measures in those locations to protect your customers, your constituents, your students, right? Require vaccination or strongly encourage vaccination, require masks, require distancing, particularly in areas where you don't know the vaccination status of the people who are gathering. Reduce the size of gatherings to the greatest extent possible. Require masks at every indoor event. We just really need those layers to try to slow this very fast outbreak, this highly transmissible Delta variant. All right, I will answer a couple of questions. Someone asking, of the almost 1,000 deaths reported, how many of those are Mobile County residents? So all of the deaths that we report on our daily and weekly report are Mobile County residents. The number of cases that we report are also Mobile County residents. The one data piece that we report that has a mixture of Mobile County and out of Mobile County people are the hospitalizations. So hospitals report to us in aggregate, and they report some information on individuals, but that information does not include any location information. So it doesn't include anything about their address or what county or zip code they live in. So again, cases are Mobile County residents, deaths are all Mobile County residents, but the number of hospitalizations includes both within county and out of county residents. What is the lag time between seeing a decrease in positive test and a decline in hospitalizations? So generally these things sort of work in 10 to 14 day cycles. So if you get exposed, then you generally will develop symptoms between 2 and 14 days. So depending on when you get sick, if you are going to get sick enough to require hospitalizations, it will usually happen, 5 to 10 days, by 14 days for sure. And then once you're in the hospital, the time actually varies greatly. But on average, people will be in the hospital 7 to 10 days. But if they are sick enough to require lengthy hospitalizations that might lead to deaths, then we often see a longer lag in the spike in deaths. But we are already seeing spike in deaths. The number of people who have died with COVID on a weekly basis has increased each week for the last 3 weeks. So someone asking about the mall. Let's see. Do I think the mall location was so popular for vaccination testing when other clinic sites were not? So I think it has to do with a lot of factors. And, I spent a lot of time at the mall hearing people, listening to their conversations, answering their questions, that sort of thing. They felt like the mall was just easy space to get in and out of. There's plenty of parking. It's a neutral location. It's not downtown. A lot of folks still, don't like going to downtown Mobile. The waits were manageable, particularly compared to other urgent care clinics around town. So we would hear, oh, I just came from Walgreens because they ran out of tests, or I just came from Greater Mobile because the line was wrapped around the corner. So we would hear those kinds of anecdotes. We did have lengthy waits sometimes, usually no more than an hour and 15 minutes or so. But most people said, this is a neutral location. It's easy to get in and out. And those were that's the type of feedback that I received when I was there. Someone asking about apathy for vaccine. Do I believe a large number of unvaccinated Mobilians are apathetic, meaning that they will only get the vaccine if it's easily accessible in a very public site such as the Shops of Bel Air? So, I was really encouraged to see, an increase in the number of vaccines given for 2 weeks in a row, and then disappointed that it dropped off a little bit last week, despite us being at the mall and giving over 1,100 vaccinations there at the Shops of Bel Air. I do think that we may have, invited and lured people who were maybe on the fence and maybe, came because it was more convenient to them. I'm not quite sure how or if we're going to be able to reach the other 60% of people who still are not getting vaccinated for very personal reasons, I'm sure. Every time I have a conversation with someone about, are you vaccinated? Do you plan to get vaccinated? There are infinite number of reasons that I'm given for not getting vaccinated. I think that convenience is probably not what's driving people now to not get vaccinated, because you can walk into any pharmacy in town and in most locations get a walk-in vaccine, and certainly call and get an appointment at any pharmacy just about in town. So it's everywhere. There are just some people who are not quite ready to take the COVID vaccine yet. All right, someone asking about at-home testing for COVID. Do we have any recommendations for consumers looking to buy one? Is there concern they're less reliable? If promised positive at home, should you report it to the health department? So let me try to handle these one at a time. We know that the rapid antigen tests are slightly less accurate than PCR tests, but when the community transmission, when the prevalence of disease is so high in our county, what happens is the accuracy of those tests gets better, right? So we see more true positives and less false positives than we do when there are low levels of disease transmission in the community. So I think that the advantages of an at-home, rapid, do-it-yourself test far outweighs some of the drawback of it being slightly less accurate than a PCR test. If you do test positive at home, remember you have to stay home for 10 days, and everyone living in your household has to stay home for at least 14 days since their last exposure. So if they are unable to separate from the COVID positive family member, then they will be continually exposed through 10 days, and then their 14 days of quarantine would start after day 10, meaning that they would be home for 24 days. You can report it. We've seen some self-test reports in the statewide system. It's called the COVID report card, and we can probably put it in the chat box for Facebook Live so that if you want to report your at-home positive, COVID positive result, that you may do that. All right, there is a rumor that a local medical center had 13 COVID patients die just last night, and that the hospital only has space for 2 in their morgue. I can't verify that. I would talk to the medical center and try to get that point verified. I have not heard that, so I can't confirm nor deny. But we do know that this is a side effect. This is an outcome that is expected when you have record numbers of cases leading to record numbers of hospitalizations. It's going to lead to record numbers of deaths. I had hoped that the deaths would stay very low because so many people over the age of 75 are vaccinated, but because 90% of the people getting COVID, 90 to 96% of the people who are getting COVID and getting hospitalized with COVID and dying from COVID are unvaccinated, and Delta is so highly transmissible, we're going to see really high death numbers. And we are talking again about getting refrigerated trailers and making sure we have enough, bags to store decedents appropriately, but this is stacking up our entire healthcare system. So, having a packed emergency rooms means the ambulances can't offload patients, so they sit at the hospital, which means someone who has a wreck or has an injury or has a heart attack can't get an ambulance to go to the hospital. So these sort of, cascades are happening all out throughout our healthcare system. If you have so many people being hospitalized and so many dying, hospitals can't keep them. They try to get them to funeral homes, and then funeral homes start overloading with decedents that need to be processed. So, we have internal discussions when things get bad like this, and we have been for several weeks, to talk about what happens if our healthcare system crashes. Where do we put bodies when we don't have enough room to store them until they can be processed for the end of their life? So what we need people to do is right now start wearing masks. Require masks in your businesses and in your workplaces and in your agencies and in your schools particularly, so that we can slow transmission and stop so many people needlessly requiring hospitalizations and dying.
The report card's posted.
Okay. Mark said that he just posted the COVID report card. So there's a link there. You just go. It's an online form. It's super easy. Let's see. Someone asking about that we did have an issue. ADPH had an issue with the data over the weekend on Sunday. That has been corrected. So today's daily report and the dashboard, our local dashboard, should be back to complete now. And someone's noticing about the rise in cases in children. So when we look at, this is on our daily report too, when we look at just the cases in the last 14 days, and it looks like there have been about 7,000, that 392 are 4 years old or less. 15% are 5 to 17 years of age. But still, we're seeing the highest number in that age group, 25 to 49, which is, that is also our highest age group for population. That's where we're seeing, a large number of deaths. And I mentioned in the last week we had a 22-year-old who died, so that's showing up on the report. And then 4 people aged 25 to 49 that have died with COVID. So yes, it is still very much an outbreak in younger people and unvaccinated people. Someone made a comment on Facebook that with people testing at home makes it more difficult to really know how many people are positive out there. That is true. We know that we do not capture every positive. I think, I've seen some estimates about how many cases we're missing, or for every one case that we know about, how many cases are there that we don't know about. And the last time I checked, it was somewhere, I think, around 12 or 15. It could be much higher than that. But still, the data help us see, is it going up? Is it going down? How does it compare now to what it looked like in the winter? That sort of thing. So we still feel really good about the surveillance data that we do get, even though we know that we don't capture every case. All right. How many people who were tested at the mall were found to be positive? 17%. So we tested about 4,500 people in the 9.5 days that we were there, and around 17% of those were positive. That's really the best scenario, because when we're testing them, the health department, we can make sure we do the investigation on the spot, and then we make sure they leave with their quarantine letter and that they know what they're supposed to do. And that real-time case investigation and contact tracing, we hope, will help to slow things down. How are vaccines holding up after the 6-month mark of completing series? So again, the Biden administration announced last night that they, with some top health officials, have been looking at information and may be making a recommendation about a potential need for a booster dose for normal people, right? We know a 3rd dose is needed for immunocompromised, but for everyone else, a booster dose may be coming. But I don't believe they'll make that recommendation until Pfizer and Moderna both get full FDA approval. Do drugstores have both products for a 3rd dose? So here's the thing about the 1st dose and the 2nd dose and the 3rd dose. It's all the same product. It comes out of the same vial. So there's not a different formulation for the 1st dose or the 2nd dose or the 3rd dose. It's all the same product. Where has the positivity rate gone on the COVID dashboard? I will take a look at that. It is around 36%. I know it was on our weekly expanded report.
It's on the weekly, not the daily.
Yeah, it's on the weekly expanded report. It's not on the daily report, but you'll have to check our weekly expanded report. It's also not on the dashboard, on our dashboard. It is on the ADPH dashboard, or it was the last time I looked. But here in Mobile, depending on what data source you look at, it's anywhere from 28 to 36%. So 1 in every 3 people tested for COVID have COVID. That is scary. Are there any plans to do a setup like Florida to give infusion? So we are working with our healthcare partners, trying to increase capacity for monoclonal antibody treatment. I think that's what you're talking about when you say an infusion. So trying to increase outpatient subcutaneous administration of monoclonal antibody treatment. We're trying to, help hospitals build that capacity or convert to that capacity, build more capacity. We're trying to see at the health department if we can build that capacity, and we're encouraging everyone, any provider, to try to build or implement capacity for subcutaneous administration in an outpatient setting of monoclonal antibody treatment. I wanted to speak briefly to schools. There's a lot of confusion out there with parents, with owners of daycares, with teachers, with school nurses, superintendents, children, about what the quarantine and isolation guidelines are for schools. Things are quite a bit different in the classroom this year than they were last. And what we're trying to help the schools understand is that if you'll do things more like you did it last year, you'll have a better outcome. But that means you need to do things like require masks, physically distance people, cut out congregate activities like, having lunch or breakfast, going to the library, those sorts of things, after school sports. You have to increase ventilation. You need to have a seating chart. If you have a small classroom and you can't seat everyone together, at least seat everybody facing in the same direction. No, like 4 desks all facing each other in a little pod. So whatever you did last year, you need to keep doing. If you have a kid that's sick, send them home. Exclude people that they were around. It's just, and again, if they have COVID, they need to be home for 10 days. They need to be excluded from school for 10 days. If they're a contact, they should be excluded for 14 days. Now, I recognize that some direction coming from the state education agency is contrary to some of the things that I just said. But if we aren't doing the things that we did last year to slow transmission in schools, our schools are just going to open. You're going to have a high positivity rate. You have to close your schools for 14 days until everybody's through quarantine, and then reopen your school. And it's going to keep going like this because we don't have a vaccine for people under 12. We have a low vaccine coverage for people above 12. All the teachers aren't vaccinated. I think there's a fairly high vaccination coverage. So please, if you are in school, if you're a parent of a school-age kid, if your kid is sick, don't send them to school. Keep them home for 10 days. If your kid is sick, keep their siblings home, because as infectious as Delta is, if one of your children gets COVID, then probably everybody in your family is going to get COVID. So if you have one child that is sick, don't send the siblings to school. If you're a teacher or a school administrator, keep a seating chart. When you find out that one kid has COVID, consider excluding the kids that were potentially exposed. Consider excluding those kids from school. I went to school, I graduated high school in Lucedale, Mississippi at George County High School. That entire school district, George County School District, they had a 20% positivity rate in their high school. So they have closed schools. Everybody switched to virtual, and then they're going to bring them back to in-person learning on the 30th of August. So there's nothing unique about what is happening at George County School District. They're just unlucky it's happening to them now, right? This same thing, schools are not immune. You cannot keep Delta out. So do your best to layer those protections, to try to keep the positives down as low as you can, but be prepared to potentially close your schools or go to a virtual format when you either all your kids are sick and they're at home, or all of your teachers are sick and they're at home. Because I really expect that this is going to happen. It's just going to be this cycle, in Mobile County schools, similar to what we're seeing in other school districts. All right, I think that's all. Are there any questions, Mark? Any questions?
Long.
Okay. Mark says we have too many questions to answer today. So he and I will call it a day. Remember, get vaccinated, wear your mask, distance, send us your questions. Appreciate those of you who sent suggestions for potentially a new vaccination site. We really appreciate that. We've got a team looking at locations and trying to find us something. So thank you for those that heard that request and responded. We really appreciate it. It takes a village. It takes a whole community. It's going to take us all pulling together to get us over this hump. So appreciate everything that you're doing, and we'll talk again tomorrow.